Little adjustment there. March 26th version of the Montachusett Public Health Network. I now call this meeting to order. Please be advised FATV is conducting audio and video recording of this meeting for public broadcast. I ask that anyone in the audience who is recording this meeting please identify themselves for the record now by standing and stating your name and city of residence. Seeing none.
Here.
Haven't got there yet. Hold on.
I thought you just said City of Gardner. Sorry, Steve.
Micah and Angela are here from the City of Gardner.
We're having IT challenges, so please forgive us.
Yeah, okay. I'll give you a minute to straighten that out, and I'll finish the speech here. So, I ask that all electronic devices at this time be placed in silent mode. And are we ready out there? Let's conduct a roll call. Madam Clerk?
Athol.
Here.
Clinton. Fitchburg.
Here.
Gardner.
Here.
Hubbardston.
Here.
Leominster. Phillipston. Princeton.
Here.
Royalston.
Here.
Sterling. Templeton. Westminster. Winchton. Thank you.
Okay, that makes
1,
8,
2,
correct?
3, 4, 5, 6.
7.
2, 3, 4, 5, 6, 7.
Well, we do have a quorum by the skin of our teeth. So I invite anyone in the audience who wishes to speak. I see none, but not sure about virtual. Please approach the podium or raise your hand virtually. Identify yourself by name and address and the agenda item that you wish to speak. We will allow 2 minutes to speak. Seeing none, we will move on to our agenda. So the first item on the agenda is the previous meeting minutes. I believe that was the January meeting minutes. Has anybody able to take a look at those minutes? January 29th. I'm hearing silence, so I'm assuming nobody's seen the minutes.
Hold on.
We have a motion by Phil. Do we have a second?
Seconded.
Seconded by Angela. Any further discussion on the minutes? Okay, and we will do a roll call on a vote to accept the minutes. Madam Clerk?
Athol.
Yes.
Fitchburg.
Yes.
Gardner.
Yes.
Hubbardston.
Yes.
Leominster.
Yes.
Princeton.
Yes.
Royalston.
Yes.
Minutes are approved.
Next item on the agenda is the approval of funds for flu order for the next flu season, which is 25-26. Wow, that sounds so far away, but it's not. We will start the flu purchase season. I believe last year we started off with about $70,000. I think as far as our refund, our revenue from the flu season last year, I think we're close to or in the mid-90s, if I'm correct, somewhere around there, 90 to 95% in return of the funds. So we're looking to do the same thing all over again. I can tell you that there are funds available in our revolving fund for the year, so I believe the ask is for $70,000 to start, and then we'll update the towns as we go. Any discussion on that? Any concerns?
Move to 70.
We have a motion by Phil to move to 70. Any further discussion or vote out there?
I'll second that.
seconded by our Vice President. Any further discussion on the flu purchase? So, Madam Clerk, let's do a roll call on the flu purchase of $70,000.
Ethel,
Agree.
Fitchburg,
Yes.
Gardner,
Yes.
Hubbardston,
Yes.
Lemonster,
Yes.
Princeton,
Yes.
Royalston,
Yes.
all in agreement.
Boy, this is easy. Next item on the agenda is Chelsea Patras from Chinan 9. She is going to give us a presentation. See if I can pull that up.
You want me to do it? I've got it here
You got it?
for everybody.
Oh, look at that.
Came
Somebody's
prepared.
watching out for me today. Good morning, Chelsea.
Good morning. How are you?
Good. And the floor is yours.
All right. So I'm Chelsea Patras. I'm the Executive Director of the Health Equity Partnership for North Central Mass, and we hold the Community Health Improvement Plan for the North Central region. So I'm going to present to you today the 2028 CHIP. This is based on the 2024 recently completed community health assessment work. The report is available. It was produced in partnership between Haywood and UMass Health Alliance Clinton, and they each hold their own community health improvement plan at the hospital level. And so what we do is take that plan and say, okay, so what portions of that plan do we hold at the regional level? Let me just, come on. There we go. Okay, so going back, we have held a community health improvement plan for the last 3 cycles. We began in 2016, and now we are on the 2028 CHIP. The domains that we had already were racial and social justice, healthy food access, healthy and safe relationships, mental and behavioral health, and transportation, housing, and the built environment. Of that, we developed 13 goals in 2025, and I'm just going to take you quickly through. What we did after that was go through a process with community members across the region and really looked at what our role as a convening organization, a policy and systems level change organization is, as opposed to our direct service partners and member organizations. And so we did what was called a key domino analysis and said, if we want to be at the root level, what do we have to be doing? And so this is kind of how it stratifies out, is that the basic conditions for human health are mental and behavioral health, safe and affordable housing and shelter, affordable and cultural appropriate healthy food, and those are direct service types of work done by our partners. These all exist in our learning environments, our work environments, also partners within our ecosystem, and so we sit at the bottom, the foundational level of this, where we do anti-racist work, work on strong connections and collaborations between over 240 partners across the region, work on policies and funding that support public health and social services. We sit on over 40 committees, working groups, advisory groups, et cetera. And new from this process was transportation as a domain that we needed to be sitting in. Okay, so the current community health improvement plan for the region. Now, I'm going to just scroll a little bit here so I can see the entire thing. All right, under racial and social justice, a lot of what the work we have been doing is revolving around our Anchor Collaborative, which is a collaboration of multiple large employers, primarily our healthcare institutions and our higher education institutions in the region, working on the things that give people access to pathways to good jobs, especially in our healthcare industry. And so those pathways involve both education, but also childcare, transportation. More and more it's involving language access and English as a second language and certifications in for folks who may have English as a second language. Also in racial and social justice, we are working toward equity in our schools, so equity in our education institutions, looking at some community anti-hate campaign that we are running currently, a Know Your Rights campaign. These are newer and in response to more recent events. And we also have been working on, we have a civic engagement toolkit that supports community leadership. We are in our second year of having a youth advisory council and a Spanish-speaking ambassadors program, which gives people who maybe traditionally have not been in leadership positions or in decision-making spaces more access to those spaces. Under healthy food access, we acknowledge that we still have very high food insecurity in our region, and more than that, we have had essentially a broken food system that makes it not profitable for our many local farms to sell their produce in our region. And so we have low-income consumers who have very little access to fresh, healthy food. And so Local Food Works is an organization, a coalition of multiple stakeholders in the food system, from our farmers all the way through our consumers. And the key piece of that has been to build the middle tier, which is our aggregation distribution, and give that give access to our large buyers, so our institutions, to be able to support that system. So that's involved having an ordering system for them. We just opened the local food processing center in Gardner, which is doing that aggregation, light processing, and distribution. And now we are looking to grow and sustain that. We are in year 3 of a 5-year plan to self-sufficiency and profitability for that. We also support things like Food is Medicine and some of the programs associated with healthy food access in those ways. We've also been working with a lot of our partners on increasing the capacity and the connectedness of our critical needs access programs. We know a lot of our programs, like our food pantries, do a lot of individual running around to stock their pantries, and we have been working with them to have some better systems in place where that's more efficient and done in more of a cooperative nature. Healthy and safe relationships. We have been working on crisis prevention and response systems region-wide. Some of our cities and towns have embedded clinicians in their police departments. We're also working on finding funding for them to have DV, domestic violence advocates, embedded with them. Bringing the syringe service program and mobile harm reduction to the region is something that is new, and I would love to bring someone from Mass Department of Mental Health to come and talk a little bit more about the opportunity there for cities and towns to take advantage of that. There has been funding through DMH to have these programs. North Central Mass is one of the only regions of the state that does not have mobile harm reduction in our region, and that was primarily because we did not have an identified provider. Community Health Connections is now able to be that provider, and so now it's a matter of individual cities and towns kind of having that discussion at the local level and deciding if mobile harm reduction is right for them. And it is free once they've done that and worked it out with the Department of Mental Health through the grants that they offer. Let's see what else under that. Lots of notes from our sexual and domestic violence partners that they have seen dramatic increases in the number of incidents and the violent nature of those incidents. A lot of things are getting in the way of safety, such as lack of housing, lack of financial stability and independence, and more recently, an exacerbated distrust and mistrust of our legal systems. A lot of people have been reporting that they are seeing more and more people not going to court, not renewing restraining orders because they are afraid to be shown in public or involved in the justice system. In mental and behavioral health, and there's a significant overlap between our work in healthy and safe relationships and our work in mental and behavioral health. So we could parse out which things belong where, but they're kind of very overlapping. Working very much on data collection in our K through 12 system because you can't fix what you can't track. And so collecting health like our YRBS surveys, which is the youth risky behavior surveys, is very important. And we are seeing high numbers of poor mental health, girls twice as likely as boys to have poor mental health, and our LGBTQ plus youth 3 times as likely to have poor mental health as any other age group. And so those are driving our policies and our trainings and other aspects of the Community Health Improvement Plan to really shore up those programs. Continuing to work toward prevention of substance use and increase access to mental and behavioral health services overall. Notably, in our neighboring region of the Neshoba Valley, we just lost 15 Jerry Psych beds when Neshoba Valley Medical Center closed, and there is no current plan for those beds to be replaced in this region, and we are working very hard to get the message across that a net zero across the state when those beds have been added in Boston does not translate to helping our region here. We are working toward increasing age and dementia-friendly plans across across our region. We just applied through the city of Fitchburg, thank you, Mayor Squalia, for age-friendly North Central with AARP. So the entire region will be part of a age-friendly plan, which really just opens up and acknowledges the work that's already being done across our cities and towns to be age and dementia friendly. Transportation, housing, and the built environment has been a really big one for us, specifically in transportation. We have just restarted the Regional Coordinating Council for the region that had been defunct and not meeting since 2019. So that is a coalition of any towns and social service organizations or agencies that serve low-income populations, our seniors, our veterans and disability populations, and really working toward how to improve and connect those systems with one another, look at collaborative opportunities for services and for funding, and to look at new models that could be adopted for transportation, but also for livability, housing, other like age-friendly opportunities, digital equity. So there's other things that can be wrapped into that regional coordinating council. I think I talked about a lot of this already. Certainly advocating for increased shelter options. We're actually seeing decreases in shelter options, so we're moving in the wrong direction there, and long-term affordable housing solutions. We are actively in several advocacy groups working toward making the needs of North Central known in the housing spaces. I think everybody knows about the housing crisis. Okay. And so new for 2028 is healthcare access, which was a new domain not previously in our CHIP. And that came about primarily because of things like the loss of the maternal care unit at Health Alliance and the closure of Neshoba Valley Medical Center. We have a lack of pediatric care in our region, and now a lack of maternal care, as well as a lack of behavioral health beds, especially inpatient services. And so really this needs to be addressed at the policy level, and the needs of our region need to be amplified and addressed at the state level, because there are certainly policies that are making our smaller community hospitals more vulnerable, and so those are the things that we are working on there. All right, let me see, do I have anything else? Any other slides? I don't think so. All right. So, I'm sorry, under general CHIP support, some other things that are happening in our work that kind of address all aspects of the Community Health Improvement Plan are really working with diverse voices. So I talked a little bit about our youth advisory group, our Spanish-speaking advisory group, and working toward making sure that everyone has access to civic engagement tools so that they really understand how to get engaged at the local level. I know, our towns often struggle to recruit people to boards and committees. And so, giving people more access to those spaces through education of how to be involved in those is a priority of ours. Again, getting recently certified through AARP as an age-friendly region. We'll be doing an event around that as soon as we get the certificate. And we will have our legislative breakfast on April 11th, followed by a social services networking event that will be at Great Wolf Lodge. Anybody who wants to register for that can email me. I think my email will be available somewhere. It's Chelsea, CHELSEY at Chena9, CHNA, the number 9.org. You can email me for the registration link if you don't already have it. We do continue to have mini grants that we offer and technical assistance on projects and partnerships. Several working groups that people can plug into and attend. And I think I hit everything. And I do have, if anybody has thoughts or questions, I can take any.
When was that Grey Wolf event?
April 11th.
April 11th.
The legislative breakfast.
Yep.
Registration starts at 7. The program starts at 7:30 and goes until 9:30, at which point we'll transition the room over for the Social Services Networking Fair, which is a great opportunity for our social service agency partners to meet one another. We heard from a lot of our organizations that either due to staff turnover or just new clients asking for services that they don't have or that they don't have capacity for, that they really needed to be able to do better referrals. I think everybody kind of knows that you're more likely to refer to someone who you've met in person, had a conversation with, and can put a face to a name. So that's really what this is for our social service organizations to get to know one another and be able to make those warm referrals easier.
Thank you. Any further discussion or questions for Chelsea while we have her?
Presentation. Thank you, Chelsea.
Thank you.
Thank you very much, Chelsea. Moving on to our next agenda item. We have a discussion and an update from Catherine and Kyla. Kyla is from BME Strategies. The floor is yours, ladies.
Thank you. Thank you to everyone for your engagement with the FPHS project. I know many of you have worked closely with Kyla to get this done, as I have, and her help and support and great response has been instrumental in being able to get this done. I know I would not have been able to do what has been done from this end without Kyla and her support team. So thank you, and I think Kyla has a short presentation here. Thank you, Kyla.
Thank you, Catherine. Yeah, I just have a few slides. It won't take very long. Overall, MPHN is doing an amazing job with the review. Most of the towns have finished, if not are very close to finishing. So thank you all so much. I know it's a big ask and you're all very busy folks in general, so I appreciate it. So I'm Kyla. I work for BME Strategies. And I'm just going to give a brief update. So I came in January and gave a more detailed overview of what the FPHS review is, but just as a reminder, that refers to the Foundational Public Health Services, which is a framework that was developed by the Public Health Accreditation Board, and it's been adopted in several states throughout the country. Several other states have done this FPHS review, and the data will be used to create a comprehensive statewide report that will show how the foundational public health services are currently being delivered in Massachusetts, and will enable us to do a cost analysis to determine how much money is needed to fully implement the foundational public health services across the state of Massachusetts. So as I said, you guys are doing a really wonderful job, and the first part of the tool or of the review is the cost tool, and all of the towns in MPHN have at least started the cost tool, and most are almost done with it. So that's really wonderful work, and there's a lot of you guys, and it's a lot of small towns, so that's really impressive. Thank you all. And this tool collected information on your spending and revenue in fiscal year 2024. And then we allocated that spending to the foundational public health services, foundational areas and capabilities, so we could see how much each town is spending on each of the foundational public health services areas. The second part of the tool, which is due in a few weeks, is the service delivery tool. And this tool collects information on all of the services that are being provided in your communities and who is providing those services. And the last presenter talked a lot about like partner mapping and those opportunities to collaborate with other entities in your community. And so this tool is kind of capturing some of that work that it sounds like is already happening in your communities or with other organizations in your communities. So that's excellent. And almost all of the towns have started this tool as well. So it's great. The service delivery tool is due April 18th. And then after all of the data is collected, we will have a discussion in May to share the results of your data as a shared service arrangement. So all of the MPHN communities will come together. And that's all I have for the update. The last thing is just if you have any special requests of things that you'd like to see in that May meeting where we share your results back, I'd be happy to take those requests underway, and I can try to incorporate that when I come in May to talk with you all. Thank you. Phil, is that a hand?
Yes, that's a hand.
Phil, go ahead, Phil, floor is yours.
I want to just state that having Doug Haley come around to us was a big help, especially for us little ones. So I encourage, you need more stuff from us physically to send them around.
Yes, thank you so much, Phil, for pointing that out. Doug has been a tremendous help in going to a lot of the small towns, and he will definitely be part of those May discussions as well. So we're very grateful to have him engaged as a subject matter expert. Thank you.
Any other discussion out there? Anything further, Catherine?
I don't think so, no. Just again, a thank you to everybody who put some time in. I know it was very time consuming. It was time consuming for everyone. And again, yeah, we could not have done it without Kyla and Doug's support. So thank you so much.
So if no further discussion on this matter, we will move to the next item on the agenda. I'd like to have a quick discussion about engagement with the MPHN. This seems to be a nice segue. We have been together for many years, and I believe it's about 15 now, but it appears we're starting to lose a lot of interest from the towns. We're struggling to get quarterly meeting quorums. I just wanted to throw it out there to the towns, and how can we make this a meeting that everybody can attend on a regular basis so we don't have to struggle like we did years ago. I don't think we ever had less than 11 or 12 towns. So it seems like the whole thing is kind of shriveling away, and it's probably the worst time for that to happen because there's a lot of projects going on. I was just kind of throwing it out to the towns on how can we make this better or more attractive or whatever it is that's keeping people away. Any thoughts out there?
Phil and Michelle.
I see a hand. Phil's going to save me.
Phil and Michelle both raised.
Oh,
yeah.
Phil, go ahead. I believe you were first. Floor is yours, Phil. Can you hear me, Phil?
I just want to say having this double option is key. Like, here I am in a car, but at least I can attend. I got delayed with a snowstorm, so otherwise I would have been there physically. But I do want to point out that the towns have the ability to have someone attend. So it's not just one-sided, it's you need both. So I encourage continue to have meetings, but also have the Zoom.
We're losing you, Phil. I think we'll skip to Michelle and we'll come back to you.
I was going to add, I agree with Phil. Stacey and I would have come in person today, but we've got another webinar.
Yeah, no, I don't mean, virtual attendance is fine as well. I'm just kind of, it doesn't have to be in person. I understand everybody has a busy schedule and they have deadlines to meet. Virtual is fine. And I appreciate those that are traveling or doing whatever. But, if there's no one, I don't know, maybe the timing of the meeting isn't the greatest, or just looking for suggestions out there. And if there are none, I get that too. But nothing personal, just wanted to make it more attractive.
Oh, no, I totally get that. I was going along with what Phil was saying, that, these towns sign up to be part of this, and that maybe we should really stress the importance of them to participate.
Thank you, Michelle. Phil, you want to finish that again? We lost you, Phil. You broke up. I was going to see if you could finish that.
Oh, can you hear me now?
Yes, we can.
I was just reiterating, having the virtual option is key, but that individual towns need to have someone, even when someone's on leave, to make sure there's somebody there that can attend, at least to represent the town. But we do have our own responsibility, but the virtual option, I think, is key, and I think our legislature is going to extend it at the Senate right now, so.
Yep.
Yeah, hopefully they will, Phil. I agree. Judy has her hand raised.
Oh, thank you, Judy. The floor is yours.
You mentioned projects, and so I was just wondering if that could be added to the agenda. What are the projects that MPHN is doing, and how do they impact the cities, and then how are they impacting the little towns like Hubbardston and Royalston and Princeton and Phillipston? So if we could maybe highlight some of you have grant money coming in, where's that going, and how is that going to impact or support or benefit the different entities that are part of your network?
Interesting question. Anybody want to tackle that? I think a lot of the answers to your question can be discussed in our next agenda item, which is the annual business meeting. And maybe if we jump to that, that will help. But as Catherine and Kyla mentioned a few moments ago, the to start, the Department of Public Health has laid out several projects for the Montachusett Public Health Network, as well as all the shared services networks out there. The FPHS tool is one of them, and it is a cumbersome process, but we're hoping that combining all this information from each of the towns, we can improve on how we offer services to our residents throughout the 13 communities. And I think that these surveys and the cost tools will help with that. Anybody else have any further comment on that?
I just want to also say, yeah, so we do have, working with PHE, the grant money that's coming in. Like you say, Judy, there certainly is grant money coming in, and we have a work plan that we have to make at the beginning of the fiscal year, before the fiscal year starts. And on that work plan, we have several items that we have to work on. One of them being this FPHS, which was on our work plan for this fiscal year. Also, we had a couple of projects with trying to improve and consolidate and make unique, or not unique, make aligned is the right word, aligned our inspection projects. So food protection inspections and Title V inspections were two specific areas that we were working on to try to align how everybody is doing that within the MPHN. Those are some other projects that we were working on. We have the sunscreen project that we were working on, that we provided sunscreen dispensers into the different towns. that work plan that we have for this fiscal year is, on its way to being finishing up for this fiscal year, and we will be starting probably next month, creating new items to add to our next year's work plan, and we will be discussing that in May. And this fiscal year's work plan was discussed at a previous MPHN meeting where we kind of went over all of those work plan items. That was my input. Thank you, Steve.
I appreciate that. Thank you for the assistance on that.
I was just thinking, putting it on the agenda as updates, is like if the town, is invested in a particular project, then, having the agenda reflect updates on your different projects, that would probably entice me to come each meeting to, like what's going on, where's the project that's going to impact me, where is it, what's the status, et cetera, et cetera.
Sure, understood. And we have, different agenda items we needed to do for this time. But yeah, certainly we didn't have any updates on what we're working on this time and during our meeting because of the other agenda items. So yeah, trying to limit that. I think Kyla has her hand raised too, Steve.
Excellent, Kyla. The floor is yours.
Thank you. I just wanted to highlight that the part of the FPHS review, Steve and Catherine identified the areas that the funding from PHE is being utilized for all of the towns and where the shared staff have capacity and expertise and are able to deliver services to all of the towns in MPHN. And so that's something that we can certainly talk about when we discuss the results in May, and maybe that could be used to identify additional areas that you can utilize resources that are already available to MPHN that maybe aren't being utilized in all of the towns.
Excellent point. Thank you, Kyla. Any further discussion? Any comments, Judy? Are you all set?
Also, yeah, lastly, probably want to put out there that anybody has anything that they want to work on, want to use, that they see a need in their town, to please come forward and let us know, because it could be something that we can add to that work plan for next year.
And I think Catherine pointed out a project that we had earlier with the Title V inspection and the food inspection. I think it's very important that the towns share their inspection reports. I can say that I am guilty of not sharing all the documents, but we really, the process was not to identify who's doing it wrong or who's the problem child or whatever the thoughts there are, but it's always nice to know that you're doing things correctly and using forms the right way. Once you learn how to use the form properly, it's always in your favor to make it easier to get your job done. So I don't want to give the wrong impression out there with that project, but it was not very well attended by the towns, and I think we would get a whole lot more results in the future if more of the communities participated. And I do realize some towns do not do Title V, sometimes towns just only do Title V, but it really was a small project and an excellent way to make sure that you're doing things right out there, and it benefits everybody. That's all.
Our fine epidemiologist just gave me another suggestion of a project that we worked on from the lead prevention program that we're doing. The elevated blood lead level project was actually brought up from Deb Vondel in Athol. When she was working, Victoria had gone to her and said, if there was something in public health that you would like to see an improvement on, and what would that be? And Deb said, we have a lot of lead poisoned kids, and how can we improve those numbers so that we're not seeing as many kids with lead poisoning? And Victoria went to the state, state-led prevention program, and we're actually one of 2 communities that are doing a elevated blood lead level program that we're reaching out, community health workers and our case investigator, Cynthia, that works contacting families with children with high blood levels, but they're not poisoned, they're just elevated, and giving them some prevention methods, talking them through that whole process, reminding them when their child needs to be retested, and we've had excellent results with that, and are seeing those poison levels coming down as a result of that. So that's one example of, Deb brought that forward to Victoria, and we started that project, and it's been a huge success. And that's working in all towns that have those elevated levels come to us. We work with those families.
Excellent, thank you, good point. And to Judy's point, I think it is a great idea that we concentrate a little bit more on updating for projects, so we will make the agenda adjustments for sure. That's a terrific suggestion. Thank you, Judy. Phil, I see your hand up.
Yes, I'm just wondering, is the sunscreen project going to be going on this year?
Absolutely, Phil. Yep, we'll be working on that probably in early May, would be my guess. Yeah?
Yeah.
Oh, after Memorial Day. Okay, so end of May.
Anything else? If I could ask Mr. Bolio from FATV to allow me to share my screen. Thank you, sir. It's going to give me a hard time, I see. So can folks see that? Can folks see the budget line items?
That's not up there.
No.
Let's try it again.
Steve, so we get that.
So while Dan is doing that, I just wanted to sort of finish up our annual business meeting. It seems like every meeting we do bits and pieces of it. So I thought maybe that this would be a good time to spend a couple of minutes on the FY25 budget expenditure report. Thank you, Dan. I'll just go over it really quickly. This is our reporting for the second. It's not done by quarterly. It's done triannually. So this is our second report, second of 3. It basically shows the budget that the network has approved at the beginning of the year, and as of March 31st, well, actually February 28th, would be the end of the second triannual report, and this is where we stand. So I'll go over it very quickly. Total spent is the top line. We are underspending so far. 57.8% of the budget is remaining. Our shared services coordinator is on staff and on board with the expenditures. The health inspector position, that has been a tough position this year. We do have a part-time health inspector who is in training. However, we've run into issues with staffing here. One of the position of the inspector actually has 3 hats. One of them is to cover the scale house at our landfill. When the scale master is out, the scale master has had some surgeries and has been out since September. So the health inspector hasn't been able to spend a lot of time with the MPHN, so thus the small amount of $5,000 of amount spent for the fiscal year. But hopefully we'll see some return once our scale master comes back, and he does have a third duty, which is also weights and measures within the city of Fitchburg, but hopefully we can send the inspector out for some training, get him up to speed. I do thank a couple of towns that are utilizing the inspector for some services. The next line item is our nurse. We haven't had a nurse on staff for quite some time now, and so we have no expenditures there. The next line item is our epidemiologist, who's been on staff, and the expenditure there is in line with the fiscal year. The other public health staff is partial funding of the disease investigators, as Catherine and Victoria mentioned earlier, or Catherine mentioned earlier, that they're conducting special projects, such as, in addition to disease investigation, such as the lead paint project that we've discussed, and others. So the expenditure there is on track for the time of year. If anybody has any questions, certainly raise your hand. I'm kind of speeding through this because I know it's not real interesting, but it's part of the duties of the lead agency. The next line item is the administrator or the clerk. We have reached our limit on that, so we will direct spending as necessary to make sure we stay within the budget. We do have other funding sources and grants within the city that that position needs to spend some time on anyway, so it kind of goes hand in hand with the plan. As far as consultants go, we do have a contract with Communicate Health. They are preparing flyers and how to supply towns, if interested, in communication materials. Not much of an expenditure there, but we expect more expenditures from them. And if anybody would like to see some of the services that they have provided us so far, we gladly share that. And maybe that's a good agenda item for the future. Let's see. Next item is the membership fees. Basically, that was for the PHE staff to continue on with membership to MHOA and MEHA. MIHA. And if anybody has any budgetary issues within the towns, we can certainly have a help out with memberships. Not a huge budget there, but we can still amend the budget. There is room to do that if folks are having troubles paying for their membership dues. The next thing is nursing supplies. A little bit heavy on spending there, but it looks like we can stay within budget for those supplies. Basically, those supply our flu clinics in the fall, where the flu clinic team goes around and provides clinics for all the communities that wish to have the assistance.
If I could just mention, Steve, the reason that expenditure...
You got to come to the microphone.
I just wanted to provide some context for why that expenditure is higher than we expected. Our vaccine freezer broke, and we had to purchase a new one, so that's why we had a bit of a bigger expense than we initially had planned for. So, just for some context.
Forgot about
Thank you for the context.
Forgot about that fun.
I forgot about that myself. Always nice to keep vaccine cold. Let's see. Telecommunication is the next line item. We're about in line there. The telecommunication basically allows the disease investigators communication. They have phones, and that usually that line items fund the phones for that portion of the staff. Not much mileage submitted for MPHN staff, so a little bit underspent there at this time. And then the sticky line item that the lead agency is allowed 15% of the expenditures of this grant to go towards the budget for the city of Fitchburg. So at this time, we're a little over budget there because we figured we would have a full staff. That has not happened, so we've gone back to the 15% for the first 3 months of the year or 4 months of the year, and we will adjust that as we go based on the expenditures tri-annually. I want to say quarterly, but it's tri-annually. Any questions on this boring topic? If no questions,
I don't know if you just want to point out, Steve, that fringe line also.
did I miss something?
Just the fringe is covered in the budget.
I apologize, I skipped that line item. Right now, all the PHE staff or anybody that works under the Public Health Excellent Grant must contribute to the city's fringe benefits. We have done the fringe benefits for the employees that have contributed in the first third of the fiscal year. Hopefully we'll have another expenditure very shortly. But basically that's what that line item is all about. Thank you for pointing that out. Did I miss anything else?
I don't think so.
So if there is no discussion on it, I would entertain a motion.
Move it.
Phil has made a motion to approve it. Is there a second?
I'll second it, Steve.
I think that was Michelle. I appreciate it. Any further discussion? Madam Clerk, roll call, please.
Athol,
Yes.
Fitchburg,
Yes.
Gardner,
Yes.
Hubbardston,
Yes.
Lemonster,
Yes.
Princeton,
Yes.
and Royalston.
Yes.
Thank you very much.
Thank you all. Next item on the agenda is announcements, new and old business. I have nothing at this point. Does anybody else have any announcements or anything to add?
Do you have to take vote on lead agency for?
I believe we did that in a meeting
did we?
before last.
Oh.
I think the only thing we were missing in the annual business meeting was the expenditure or the budget.
Fair enough.
And usually it was done in December as opposed to our principle of operations plan, but I had forgotten that years ago we changed that to September. So we'll be back on track to report the annual business meeting in September, but I don't feel that it's necessary to wait that long. I can certainly give updates after each reporting period. So one meeting we'll report on the revolving fund, and then the next meeting we can report on the expenditures of the Public Health Excellence Grant. That was my plan. If that doesn't work for all, please let me know, but one boring budget discussion is enough for one meeting, I think. Anything else from the MPHN? Hearing none, I will entertain a motion to adjourn.
Move to adjourn.
Thank you all.
Hey, you gotta have a second and a vote.
I think I saw a hand out there. You don't have to have a second for
We don't have to have a
adjourn.
vote, but you have to have this, yeah.
We are adjourned. Thank you, folks.